We all like to think modern medicine is pretty great, right? But to really, truly appreciate it, you gotta look back at a time when the so-called cure was way, way worse than the disease. Today, we're gonna dive into some of ancient history's most painful, most terrifying, and just downright awful medical treatments. So you might want to buckle up.
And trust me, that is not an exaggeration. We're talking about procedures done with no anesthesia, with a, let's say, basic understanding of how the body works, and with tools that look like they belong in a blacksmith shop. So yeah, take a deep breath, be very, very glad you live in the 21st century, and let's get into it.
All right, we are kicking things off with a real pain in the, well, you know where. Hemorrhoids. It's a common problem, super uncomfortable, but today it's a very treatable issue. But back then, the solution was less about a soothing cream and more about sheer, brutal, fiery force.
I mean, this slide just says it all, doesn't it? The difference is staggering. Now, the ancient logic, as flawed as it was basically that hemorrhoids were open wounds. So what do? You cauterize them with a hot iron rod. You just seal them right up. Simple, right? Except, what happens if the doctor misses? The reality was just immense pain and the very real risk of some serious collateral damage. And this whole cure with fire philosophy, it was championed by none other than Hippocrates himself. You know, the father of medicine, all the way back in the 4th century BC. As you can see, his whole treatment plan escalated pretty quickly. It's a brutal way of thinking, but it really shows you just how desperate both doctors and patients were for any kind of solution. So let's move on from one uncomfortable area to another, shall we? Urinary obstructions. They have been plaguing humanity for thousands of years, and for just as long, we've been trying to solve the problem by, well, shoving things up there.
You know, the catheter has a ridiculously long history, but for most of that time, it was not the flexible tool we have today. No. It was a rigid, often metal tube with rough, handmade edges. And with no real painkillers, besides maybe some alcohol or biting down on a stick, the procedure was delicate, tricky, and just agonizingly painful. One little wrong move could tear you up inside and lead to a deadly infection.
And this is where things go from just painful to the absolute stuff of nightmares. If a metal tube couldn't clear the blockage, that probably meant it was a calcified stone. And the only way to get that thing out was to cut it out.
The procedure was called a lithotomy, which literally means stone cut. And as this definition makes grimly clear, the incision site was not great. We're talking about the perineum, that small patch of skin between your genitals and anus. That was the point of entry.
Just look at this process. It was a total nightmare. Assistants would have to physically hold you down, while a surgeon, who was basically going in blind, would cut into you and try to fish out the stone with a hook, or even just their fingers. One source I read compared it to trying to get the last chip out of a Pringles can. And after all that, you'd be sat in a pool of vinegar and salt. It is an absolute miracle that anyone survived this.
Okay, if you thought cutting into someone's perineum was bad, just wait. Our next section takes us to what might be the most famous and unsettling ancient surgery of all, deliberately drilling a hole into a living person's skull. This is called trepanation. It is one of the oldest surgical procedures we have any evidence for, dating all the way back to the Neolithic era. It was done all over the world for a bunch of different reasons, from treating headaches and skull fractures to literally letting out evil spirits that were supposedly causing mental illness. And hey, they had options. This table shows the different ways they'd go about it. You could cut a rectangle out. You could slowly scrape away the bone. You could use a circular saw called a trephine, or you could drill a bunch of little holes. Every single one of these methods was delicate, grueling, and performed on a patient who was almost certainly wide awake.
Now here is the absolute shocker. This number, 80%, is the estimated survival rate. How do we know? We found skulls with signs of bone regrowth, which means the person lived long after the procedure. How in the world could the survival rate be that high? It's mind-boggling, but one theory is that skull surgery had a lower risk of systemic infection than abdominal surgery, and if you successfully relieve pressure on the brain, it could have had immediate life-saving effects. Still, wow.
Trepanation was sometimes used for battlefield head wounds, which just goes to show you the desperate measures people took. But what if the wound was somewhere else? Well, on the battlefield, getting shot with a barbed arrow left you with these, charming options. That fourth one, tying the arrow to another arrow and firing it away to rip it out, is just particularly horrifying.
And after all that, they'd pack your wound with some honey and wrap it in a probably not very clean cloth.
All right, from holes in the head, we now move to needles in the eye. Our next topic, ancient eye surgery, is a real testament to human ingenuity and, let's be honest, sheer terror. We're going to talk specifically about cataracts.
The procedure was called couching. So a cataract is when the lens of your eye gets cloudy. The ancient solution? You take a needle, you poke it right into the eyeball, and you physically knock that clouded lens out of the way. Now, to his credit, the physician Sushruta was centuries ahead of his time when it came to hygiene, but sterilization was still far from perfect.
And this slide, this shows you the grim reality of that. Despite the surgeon's best efforts, agonizing infections were super common. The procedure had about a 70% chance of making you go completely and totally blind in that eye. You had to be truly desperate to be willing to take those odds.
Okay, we've arrived at our final, and maybe the most significant, medical mistake in history. If the other cures we've talked about were specialized instruments of torture, this one was the universal blunder that absolutely dominated medicine for 2,000 years. It was, as one source put it, the basic bitch of ancient medicine.
The four humors. This theory, also from our good friend Hippocrates, was the foundation of Western medicine all the way up until the 1800s. It basically said that every single illness, from a cough to depression, was just caused by an imbalance of these four essential fluids in your body.
So if you had too much phlegm, you had a cold. Too much black bile, you were melancholic. Too much yellow bile made you angry and irritable. And the most common diagnosis of all? Having too much blood, or bad blood. The whole logic was simple, it was elegant, and it was completely and totally wrong.
And the cure for having too much bad blood? Well, naturally, you just had to get rid of it. This practice, known as bloodletting, involved cutting a patient open and draining their blood, often until they fainted. This didn't just fail to cure the original problem. It actually made the patient weaker, more susceptible to infection from the open wound, and way less able to fight off whatever was actually wrong with them in the first place. And that's really the ultimate takeaway here. Modern medicine is far from perfect, but it's built on centuries of trial and, as we've seen today, horrific error. So the next time you have a headache and you reach for a simple pill, just take a moment. Be grateful you're not reaching for a hot poker or a drill. It really puts things in perspective, doesn't it?